Did you know a simple vitamin might help undo kidney damage? It's amazing to think something so small in our everyday food could actually help our kidneys and maybe even fix the harm already done. Our kidneys are super important for our whole body to stay healthy. Yet, lots of people don't know about the hidden dangers our kidneys face. One big problem is called proteinuria. It means there's too much protein in our pee, and it can be a hint that our kidneys aren't doing their job right. We don't often spot proteinuria because it's sneaky and doesn't make a lot of noise with big symptoms, but it's really important for our health. Now, there's exciting news. Scientists have found a vitamin that's in lots of foods that we could be eating every day, and it might help stop proteinuria and even help heal our kidneys. This vitamin works like a repair crew inside our body, helping our kidneys keep the protein in our blood instead of losing it in our urine, which is how it's supposed to work. If proteinuria keeps going without us doing anything, it can lead to even worse kidney problems. Since diabetes and high blood pressure can cause proteinuria, it's something everyone should care about to keep their kidneys in tip-top shape. When protein shows up in our pee, it's like a warning sign flashing that our kidneys need help. If we don't listen to this sign, our kidney health might get worse, and that can mess with how we live our life. But here's the good part. Researchers are saying this common vitamin could be a game changer. It could offer new hope for millions of people with kidney problems or those who might get them. We're going to look more into what this vitamin is, where we can find it in our food, and how we can make sure we're getting enough of it. So, let's keep our eyes peeled, because this vitamin could be a big step in fighting kidney disease and keeping our kidneys happy and healthy. Proteinuria is a condition where there is too much protein in the urine. This happens when the kidneys are not able to properly filter and keep necessary proteins in the bloodstream. Normally, the kidneys filter waste and excess substances from the blood, while important proteins are kept. But when the kidneys are damaged or under stress, they may allow vital proteins like albumin to escape into the urine, causing proteinuria. This condition can be temporary, often triggered by stress or physical activity, or it can be a persistent issue that indicates more serious underlying health problems. Some common causes of proteinuria are diabetes and hypertension. If diabetes is poorly managed, it can lead to kidney damage called diabetic nephropathy, which is caused by high blood sugar levels affecting the kidney's filtering units. High blood pressure, also known as hypertension, can put strain on the kidneys and cause damage over time, affecting their ability to filter properly. Additionally, kidney diseases like glomerulonephritis, which involves inflammation of the filtering units in the kidneys called glomeruli, can also lead to proteinuria. It is important to regularly monitor kidney function and manage chronic diseases to prevent the development of proteinuria and protect kidney health. Proteinuria often goes unnoticed in its early stages because it may have subtle or no symptoms. However, when symptoms do appear, they may include foamy or frothy urine due to excess protein, and swelling in the hands, feet, abdomen, or face, known as edema. These signs indicate that the condition has progressed and is affecting the body more severely. If proteinuria is left untreated, it can have serious long-term consequences. Over time, it can lead to a gradual decline in kidney function, eventually resulting in chronic kidney disease, CKD, or even end-stage renal disease, ESRD. These conditions significantly impact one's quality of life and require intensive treatments like dialysis or kidney transplantation. Additionally, proteinuria is linked to an increased risk of cardiovascular disease. The kidneys play a vital role in regulating blood pressure, and when their function is impaired, it can lead to hypertension, a major risk factor for heart attacks and strokes. Proteinuria can also worsen the underlying causes of kidney damage, such as diabetes and hypertension, creating a harmful cycle of declining kidney function and escalating health problems. That's why it is crucial to detect and treat proteinuria early, while also carefully managing any underlying conditions to protect kidney health and prevent the severe consequences of this condition. It is important to understand the significance of kidney health and taking proactive measures to protect it in order to prevent the progression of proteinuria and maintain overall well-being. The kidneys are vital organs that have essential roles in our body. One of their main functions is to filter waste substances and excess materials from the blood. These waste products are then eliminated from the body through urine. This filtration process happens within millions of tiny filtering units in the kidneys called nephrons. Each nephron has two main parts: the glomus, which filters the blood, and the tubule, which adjusts the filtered fluid to ensure that necessary nutrients and the right amount of water are reabsorbed back into the bloodstream. Meanwhile, waste substances and excess water are turned into urine. In addition to removing waste from the body, the kidneys have an important role in balancing bodily fluids. They regulate the volume of blood plasma, which affects blood pressure, and ensure the proper balance of electrolytes like sodium, potassium, and phosphate. This balance is crucial for various bodily functions, including nerve signaling, muscle contraction, and maintaining a stable internal environment called homeostasis. The kidneys also produce hormones that contribute to these regulatory functions. For example, they produce erythropoietin, which stimulates the production of red blood cells in the bone marrow. They also produce renin, which helps regulate blood pressure. Additionally, the kidneys convert a form of vitamin D into its active form, which is important for absorbing calcium and maintaining bone health. Considering these essential functions, it becomes clear why maintaining kidney health is extremely important. When the kidneys are not functioning properly, such as in cases of proteinuria or other kidney diseases, the consequences can affect the entire body. When waste products start to build up in the blood, it can lead to harmful effects on the body. Imbalances in bodily fluids and electrolytes may occur, and controlling blood pressure can become difficult. These issues highlight the crucial role of the kidneys in filtering waste, balancing fluids, and ensuring our body's proper functioning. If the kidneys are damaged or impaired, it can have a cascade effect on our health. This can significantly impact an individual's quality of life and overall well-being. When the kidneys are not able to perform their critical functions of filtering waste from the blood, regulating bodily fluids, balancing electrolytes, and producing important hormones, various problems arise. Each problem has its own set of consequences and complications. Firstly, when waste products accumulate in the blood, a condition called uremia can occur. This buildup of toxins can lead to symptoms like nausea, vomiting, fatigue, and confusion. These symptoms reflect the body's inability to effectively cleanse itself without proper filtration. The toxins continue to circulate, causing harm throughout the body. Fluid and electrolyte imbalances are also a significant concern. The kidney's impaired ability to regulate fluid levels can result in swelling, typically in the legs, ankles, and around the eyes. Imbalances in electrolytes, such as potassium and sodium, can cause serious issues. These imbalances can lead to heart arrhythmias, muscle weakness, and changes in blood pressure. High blood pressure is both a cause and a consequence of kidney damage. Damaged kidneys may release excess renin, a hormone that increases blood pressure. This further harms the kidneys and increases the risk of heart disease, which is the leading cause of death in individuals with kidney disease. Kidney damage can cause a decrease in red blood cells, leading to anemia. Anemia can make a person feel tired and out of breath, reducing their quality of life. If kidney damage worsens, it can result in chronic kidney disease or end-stage renal disease, which may require dialysis or a kidney transplant. These treatments can significantly change a person's life and come with their own difficulties. It is important to intervene early to prevent or slow down kidney damage by addressing the underlying causes like diabetes and high blood pressure and making lifestyle changes. Regular checkups, a healthy diet, maintaining a healthy weight, and managing stress are important steps to preserve kidney health and prevent the serious consequences of kidney damage. Vitamin D is a very important vitamin for our body. It is often called the sunshine vitamin because our skin can make it when it's exposed to sunlight. Vitamin D helps with many things in our body, like making our bones strong and keeping our immune system healthy. Recent studies have shown that it can also help our kidneys. One of the problems that people with kidney damage face is a condition called proteinuria, which means there is too much protein in their urine. Vitamin D can help reduce proteinuria and even help our kidneys heal. It does this by working on a system in our body that controls our blood pressure and fluid balance. By keeping this system in check, vitamin D can lower blood pressure and reduce the strain on our kidneys, stopping too much protein from leaking into our urine. Vitamin D is really helpful for our kidneys. It can reduce kidney damage caused by chronic diseases like diabetes and high blood pressure. Vitamin D has properties that reduce inflammation and fibrosis in the kidneys, which is good for keeping them healthy. There are two ways to get vitamin D. Our skin can make it when we spend time in the sun, and we can also get it from certain foods. Foods like fatty fish, salmon, mackerel, and sardines, fish liver oils, egg yolks, and fortified foods, milk, orange juice, and cereals have vitamin D. If we can't get enough vitamin D from sunlight or food, we can take vitamin D supplements. Making sure we have enough vitamin D in our diet is really important for fighting against proteinuria and keeping our kidneys in good shape. Before starting any new vitamin D supplement, it's important for people to talk to their healthcare providers. Especially if they have existing health conditions, they need to make sure they know the right dosage and use vitamin D safely and effectively. Vitamin D is really good for our kidneys and can help reduce proteinuria through different ways. It plays a big role in keeping our bodies balanced. One way it helps with proteinuria is by controlling a system in our body called the renin-angiotensin-aldosterone system. This system is important for controlling blood pressure and fluid balance. When this system is overactive, it can cause high blood pressure and kidney damage, making proteinuria worse. Vitamin D naturally lowers the production of a hormone called renin, which triggers this system. When the hormone production is lowered, our blood pressure goes down, there's less strain on our kidneys, and proteinuria can also decrease. Vitamin D is really good at fighting inflammation, which is often a problem in kidney diseases. Chronic kidney disease and other conditions that harm the kidneys involve inflammation, which can make proteinuria worse. By reducing inflammation in the kidneys, vitamin D helps protect these important organs from more damage. Vitamin D also has effects that can help with fibrosis. Fibrosis is when the connective tissue in the kidneys thickens and scars, and it can happen because of chronic kidney disease. This can make kidney function decline. But vitamin D has been seen to reduce fibrosis in the kidneys. This promotes the healing of damaged tissues and improves kidney function over time. Scientific studies and research trials have given us evidence to support these claims. For example, studies published in different medical journals focused on kidney diseases have shown that patients with chronic kidney disease who took vitamin D supplements had a significant decrease in proteinuria compared to those who didn't take the supplements. This research shows that vitamin D could be used as a treatment to manage kidney diseases and prevent proteinuria from getting worse. However, it's important to remember that while vitamin D can help with kidney health and proteinuria, it should be part of a bigger approach that includes managing other health conditions, eating a healthy diet, and regularly checking in with healthcare professionals. As more research is done, we'll learn more about the different ways vitamin D can be used to manage kidney diseases. This gives hope to people dealing with these conditions. Vitamin D isn't just important for kidney health and reducing proteinuria. It also has other health benefits. It plays a role in immunity, keeping our bones healthy, and even our mental wellness. This shows how important it is to have enough vitamin D for our overall well-being. Vitamin D is really good for supporting our immune system. It helps our body fight off germs and infections by making our immune cells stronger. This is especially helpful in preventing respiratory infections and might even have an impact on autoimmune diseases. By making our immune response stronger, vitamin D helps protect us from getting sick. A well-known benefit of vitamin D is that it helps our body absorb calcium from the food we eat. Calcium is important for keeping our bones strong and healthy. Without enough vitamin D, we could have too little calcium in our blood, which can cause problems like weak bones and rickets in kids. Having enough vitamin D helps make sure our bones have the right amount of calcium to stay strong. Some studies suggest that vitamin D might also have a role to play in our mental health. When we have low levels of vitamin D, there might be a greater chance of feeling down or having mood problems. But by taking in enough vitamin D, we might be able to improve our mental well-being and lessen the risk of depression. Vitamin D is also good for our heart and blood vessels. It helps regulate our blood pressure and keeps our arteries from stiffening up. This lowers the chances of getting heart disease. Making sure we have enough vitamin D has been linked to a lower risk of high blood pressure, heart attacks, and strokes. So vitamin D isn't just important for our immune system, it also helps our bones, our mood, and our heart. It's a really important vitamin for our overall health. Including vitamin D in your health routine has numerous advantages for your kidneys. It not only improves kidney health but also contributes to overall holistic health. Healthy kidneys are essential for removing waste and maintaining bodily fluid balance, which is crucial for the body to function properly. By enhancing kidney health, vitamin D indirectly supports other organs and systems. This shows how interconnected our bodily functions are. Therefore, it is important to take a holistic approach to health and manage vitamin levels as part of a comprehensive wellness strategy. Vitamin D has widespread effects on the body, playing a role in preventing and treating specific health issues, such as proteinuria and kidney disease, while also promoting overall health and well-being. Adding vitamin D to your diet is important for reaping its health benefits, including its role in kidney health, bone maintenance, and immune function. There are natural food sources that are rich in vitamin D, as well as options for supplementation to ensure you get enough each day. Some foods that contain vitamin D include fatty fish like salmon, mackerel, and sardines. A serving of cooked salmon can provide over half of your recommended daily dose. Fish liver oils like cod liver oil are also high in vitamin D, with just 1 tablespoon offering more than your daily requirement. Egg yolks are another convenient source of vitamin D. To get higher levels, opt for eggs from chickens that have been raised outdoors or fed vitamin D-enriched feed. In many countries, foods are fortified with vitamin D to help prevent deficiency. This includes products like milk, plant-based milk alternatives, orange juice, and breakfast cereals. Certain varieties of mushrooms can also provide vitamin D, especially when they are exposed to sunlight. However, it's important to note that mushrooms produce vitamin D2, which may not be as effective as the D3 found in animal products. For individuals who are unable to meet their vitamin D needs through diet and sunlight alone, supplementation can be a helpful solution to maintain adequate levels. The recommended daily amount of vitamin D, known as the Recommended Dietary Allowance (RDA), varies based on age, health status, and sunlight exposure. Generally, 600 to 800 IU, 15 to 20 micrograms, per day is recommended for most adults. Higher amounts may be advised for older adults, pregnant, or breastfeeding women, and individuals at risk of deficiency. It's important to be cautious when it comes to vitamin D. Vitamin D is a fat-soluble vitamin, which means it can build up in the body and become toxic if taken in excessive amounts. The upper intake level for adults is 4,000 IU, 100 micrograms per day, and it's important not to exceed this amount unless under medical supervision. Before starting any new supplement, including vitamin D, it's crucial to consult with a healthcare provider. This is especially important for individuals with health conditions or those taking medications, as vitamin D can interact with certain drugs. By incorporating a variety of vitamin D-rich foods into your diet and considering supplementation if necessary, you can support your kidney health and overall well-being. Balancing dietary sources, sensible sun exposure, and supplements under the guidance of a healthcare professional ensures that your vitamin D levels are at an optimal level to support kidney health and overall health. Taking a holistic approach to maintaining kidney function and overall health is very important. A key aspect of this is following a kidney-friendly diet. To minimize strain on the kidneys and reduce the risk of kidney disease, here are some important tips. 1. Limit sodium intake. High levels of sodium can increase blood pressure, which can harm the kidneys. It's best to choose fresh, unprocessed foods and use herbs and spices instead of salt for flavoring. 2. Control protein consumption. While protein is important for your body, consuming excessive amounts can burden the kidneys. Aim for a balanced intake and focus on high-quality protein sources like lean meats, fish, beans, and legumes. 3. Watch potassium and phosphorus levels. If you have advanced kidney disease, it may be necessary to monitor and limit foods that are high in potassium and phosphorus. Your healthcare provider can provide guidance based on your specific needs. 4. Stay hydrated. Drinking enough water is important to help the kidneys clear sodium and toxins from the body. However, it's crucial to balance fluid intake if you have a kidney condition that affects fluid balance. 5. Choose kidney-friendly foods. Incorporate foods into your diet that support kidney health. These include berries, apples, and vegetables like cauliflower and bell peppers, which are low in kidney-stressing nutrients. By following these tips and making conscious choices about your diet and nutrition, you can support your kidney health and overall well-being. Engaging in regular physical activity and making healthy lifestyle choices are important for kidney health. By managing weight, reducing blood pressure, improving cardiovascular health, and enhancing metabolic function, exercise, and lifestyle play a significant role in supporting the kidneys. To maintain kidney health, it's recommended to participate in regular exercise. Activities like walking, cycling, swimming, or group fitness classes for at least 150 minutes per week at a moderate intensity are beneficial. Consistency is key to fully reap the benefits. Maintaining a healthy weight is also crucial. Achieving and keeping a healthy weight helps to lower the risk of diseases that can strain the kidneys, such as diabetes and hypertension. Additionally, it's important to quit smoking. Smoking damages blood vessels, which leads to slower blood flow throughout the body, including the kidneys. This impairment can negatively affect kidney function. By incorporating regular exercise, maintaining a healthy weight, and avoiding smoking, you can significantly contribute to kidney health and overall well-being. It is important to limit alcohol consumption because excessive intake of alcohol can lead to a rise in blood pressure and potentially harm the kidneys. Moderation is key in order to maintain kidney health. Managing stress is also crucial. Chronic stress can contribute to high blood pressure and other health issues that can affect kidney health. Techniques such as meditation, yoga, and deep breathing can help manage stress levels effectively. By adopting these dietary and lifestyle changes, not only does it support kidney health, but it also enhances overall well-being. It is about creating a balanced lifestyle that takes care of your body, reduces the risk of disease, and maintains optimal kidney function. Remember, if you are making significant changes to your diet or exercise routine, it is important to discuss it with a healthcare professional, especially if you have existing health conditions or concerns. Throughout this discussion, we have emphasized the importance of proteinuria, which is the presence of excess protein in the urine. This serves as an early warning sign of potential kidney damage and should not be ignored. We have emphasized the important role of vitamin D in combating proteinuria and supporting overall kidney health. Vitamin D helps regulate blood pressure, reduce inflammation, and minimize strain on the kidneys. It is a powerful ally in maintaining kidney function and preventing further damage. Incorporating vitamin D into your diet is important. You can obtain it from natural sources like fatty fish, fortified foods, and, if necessary, supplements. Alongside a kidney-friendly diet and a healthy lifestyle, this can have a significant impact on your kidney health. Regular exercise, managing sodium intake, and staying hydrated are a few steps you can take to support your kidneys and maintain their health. As we wrap up, it is important to remember that while these insights can provide hope and actionable steps for better kidney health, they should not replace professional medical advice. I encourage you to consult with healthcare providers before making any changes to your diet or health routine. This ensures that any adjustments you make are tailored to your specific health needs and conditions. Let this journey towards better kidney health serve as a reminder of the power of simple changes in your daily life. Making small, consistent adjustments to your diet and lifestyle can lead to significant improvements in your overall health. Taking care of your kidneys and your overall well-being is within your reach. Embrace these changes with optimism and understand that each step you take is a step towards a healthier and happier you.